Hello, my name is Dr. David Shapiro. I'm with Complete Spine Solutions. What I hope to share with you today is some incredible information on a study that we're conducting in the office that we're going to publish. And it's really amazing because the only other option that this patient had to get permanently better would have been spine surgery. So with that, let's go into it. This is my background, just real quick. I've been the CEO of Complete Spine Solutions. We established this practice over 15 years ago. I've been in private practice for over 25 years. I'm advanced certified in the most researched corrective technique in chiropractic. It's called chiropractic biophysics, and that's I'm part of the extension faculty of Life University as well. So students trained in our office during the last 6 months of school who want to specialize in this technique. And with that, let's dive into this case study. So here's the deal. Someone came into my office, and I can really relate to this patient because he came in with a spinal fracture. The spinal fracture can be incredibly painful. I myself have a spinal fracture also, so I can really relate. His fracture wasn't like mine, though. So when a bone breaks or shifts out of position, when a bone breaks, it doesn't mean it's going to shift. Literally, bones can break and then also slip. That's the type of fracture that this patient came in with. It's called a spondylolisthesis, and that's what he had going on. So with that, it's not only broken in this area right over here, broken here, but it's also slipped forward. So you can see one vertebra is slipped forward beneath the supporting vertebra below. That's what this patient had. So what are the causes of a spondylolisthesis? Well, it can happen in a couple of different ways. Number one, it can happen from trauma. So we're talking about a sports injury, very common, or more common, I should say, in gymnasts. It can happen in football players as well. Wrestlers, which was my case, I used to wrestle, and it can happen in a lot of different athletes can get this fracture. It can also be due to aging, or not normal aging, but typical aging. It can cause degenerative joint disease, actually will weaken the bone structure, so will osteoporosis, and put someone more at risk for their bones not only breaking, but also slipping forward if it's in an abnormal position. So those are some of the risk factors: age and trauma. It happens to be also just more common in women versus men to have this condition. So here's our patient. He came in, he's 20 years old. He's got symptoms of soreness in his thighs. His thighs were also weak. He was a runner, and that's kind of frustrating if you're an athlete. You can't perform at your best. He's used to pushing his body to the limits, and he wasn't reaching his full potential. He also had coldness in his extremities as well. This is what his x-rays looked like. So what you're seeing on the left here is a lower back. And let me get my little laser pointer here. So here's the lower back. That's the normal position that the spine should be in. This is the front. This is the back. Here is the tailbone. And the vertebra in the lower back shifted forward on the tailbone, also known as sacrum. So the only way that can happen is if there's a break. So the vertebra literally shifted forward this way, that way. So shifted forward on sacrum. And there, the break is in what's called the pars right here. That's where the break is. And it was concerning to the patient because he didn't want to, he was at risk, obviously, for further injury. This affects the spinal cord. The spinal cord flows right here. So look what the spinal cord has to do to get into in this position. The pressure is on the spinal cord is doing this. Sorry, keep going back to it. This is called the grade 2 spondylolisthesis, and it's the 13.7 millimeters, which is significant. There are such things as worse spondylolisthesis than this. It's ideally 0 millimeters forward and just broken. If you have a spondylolysis, that's again what I have. If you look at the numbers on the lower right part of the screen, you will see this was at 13.7 millimeters here in the lower spine area. This one just above that, this one's shifted forward by 5. Not normal, and thus it's in red, and this is significant grade 2 spondy. All right. So imagine if there's some kind of technique where we could reverse engineer the spine, move it back in a position. Now, the only way that's normally able to treat this patient would be obviously just pain management, dealing with the pain, such as opiates. And we know we have a massive opiate epidemic, non-steroidal anti-inflammatories. Those are such as Aleve, Motrin, Tylenol. When it flares up, patients oftentimes take that. Celebrex, Nuprin, you get it. All of those have high risk factors, those drugs, and are generally not recommended. The British Medical Journal just came out with a massive study showing that those drugs cause heart attack, can also cause stroke, kidney failure, liver failure, gastrointestinal bleeding. So it's got a whole bunch of side effects. In our office, what we try to do with patients is figure out what the root cause of the problem is and then treat them so that they're getting off of those medications. Fix that root cause whenever possible so the patient doesn't need to be dependent upon those drugs. That's the concept. We want to reverse engineer the break from an abnormal position, put it back into a normal position. When we do that, we find consistently across the board, not just with breaks, but also with other spinal structural problems, that we can decrease pain, increase quality of life, decrease degeneration of the spine, improve mobility, function. It's awesome. And that doesn't just affect your physical abilities, your musculoskeletal issues in terms of pain, but also affects your neurology and your physiology. So that's our goal with patients: diagnose what that problem is and then try and fix it whenever possible. All right, so here's how we treated this patient. We gave him 3 things to do. Thing number 1 is exercises. Each patient is giving postural corrective exercises when they have a biomechanical problem. That's number 1. Number 2, we give them specific mechanical adjustments. Those are gentle mechanical forces, pushing the spine gently in a normal position from the opposite direction of the way it's truly bent. And the last thing is, the last component to spinal correction is traction. Now with traction, what we do is we stretch the ligaments of the spine. Ligaments harden as we age, number 1. Number 2, they'll often get used to and tighten and lock down in a position that those ligaments are in. And that makes it very difficult to make structural changes to the spine unless you address those ligaments. So just dealing with soft tissue stuff, such as muscles, it doesn't really solve the problem, doesn't actually change the structure. So we want to get to those deep ligaments that are holding that spine out of place. The only way to stretch those ligaments is to at least do a 10-minute stretch or longer. Anything less than 10 minutes does nothing at all to change the mechanics or structure of the spine. These are 2 x-rays I want to show you. So we've got the one on the left, which is the original one that was taken on 8/16/2017. And then the one on the right, we took approximately 9, 10, 11, 12, 1, 2, 3. That's 7 months later, just under 7 months later, excuse me, just over 7 months later. Here is the outcome for this patient. Pretty cool stuff. Sorry, let's get to that highlighter here. His spine was shifted forward by 13.7 millimeters before treatment. After treatment, we reduced that from a grade 2 to a grade 1. We brought it back to 5.7 millimeters. Now, please realize the only way that this is truly possible without surgery in the past it's only been surgery. It's the only other option to change the mechanics. Surgery is very risky, and it's got all sorts of side effects and often leads to more degeneration. It also often leads to people becoming dependent on pain medication. And long-term outcomes from most spine surgeries show that they do no better than people who never had the surgery in the first place. So what we really want to do with patients is bring and restore a normal position, normalcy back to the spine, put them in a better, healthier, more stable mechanical position. It's exactly what we did in this case, bringing someone from 13 millimeter displacement down to 5.7. Huge change in how people feel, function, and age. So this is the results for the patient. So just so you know, this is the percentage of change. But what we're really looking at here is the result of 13.7 before the first x-ray, brought it down to a 5.7. We took this 5 millimeter displacement of the second lumbar vertebra from the bottom, which is called L4, as it sits on top of the 5th one, brought it from 5 millimeters down to a more normal 4.1. So we slowly, gently push the spine back in place, taking pressure off the spine, off the spinal cord, and off of nerves. What are the results when we do that? In this case, as in virtually every single case across the board, when we improve structure, we improve function. This patient said, well, he's not as sore. He's feeling 95% better in terms of his thigh soreness, his weakness in his thighs and legs, 95% improve. And the coldness that he felt in his feet 70% better. That's self-rated. So amazing change and how he feels and functions. And guess what? How cool is this? He was able to run a half marathon following his care here. And that totally changed how he felt, and he felt about himself. He was able to achieve things that he wasn't able to do before. And that is all through improving the mechanics, moving the spine back into a more stable and upright, healthy position. So I want to share this cutting edge case study with you. This is going to be published in a journal soon, and when it does, I'll announce that. But I want to get you hot off the press of really cool results and how we can change people, even what was formerly not being able to be addressed in any in a corrective type way other than surgery. We're actually able to do it in a non-surgical method. So to find out more, visit our website, CompleteSpineSolutions.com. We've got more information, more case studies there, tons of videos. Look us up on Facebook and YouTube, and you'll see all the amazing testimonial videos and some of the results that we've had with our patients. If you know someone who's suffering, share this video. They may too have a structural problem. Have an amazing day. I'm Dr. Shapiro, signing out.